Hello, this is a receptionist. Um, receptionist. I'm just going to answer some questions that may be related to um, a um, a prospective GP receptionist. Question one: a patient demands to see a doctor immediately, but there are no slots left, and they refuse to speak to a triage nurse. What do you do? I believe the first thing I do is talk to the patient in a calm tone and perhaps screen the patient for red flags symptoms. And then I'll explain to the patient that the the system is fully booked. Um, Having said that, I will screen for red flag symptoms. If I feel that they have red flag symptoms, I would inform the duty doctor. Um, um, Safety must be prioritized over speed. Whilst I cannot make final clinical decisions, I have to still screen the patient for red flag symptoms because safety is prioritized over speed. Number two, you overhear a colleague discussing a well-known local patient's diagnosis in the break room. How do you handle this? Okay. When Because this is occurring in the GP surgery, I'll ask my colleague, just remind them that confidentiality is the foundation of the GP practice. Um, it gets a bit more complicated than that. The question says a well known local patient. In this situation, I'll have to assess if there has been a serious breach. If there has been a serious breach, I will have no choice but to inform the practice manager. The GP practices, first and foremost, the patient's privacy, number one, is a top priority. The GP practice's reliable reputation is also top priority. When I'm working as a GP receptionist, the patient privacy and the reputation of the GP practice always is greater than social comfort. In those scenarios where there has been a serious breach, I will have to inform the practice manager. Question 3. A patient's relative calls demanding to know the results of their 20-year-old daughter's blood tests. They are very insistent. What do you say? I will inform the relative that we have very strict data protection laws. We have to obey the GDPR rules as well as confidentiality laws. I will explain to the relative that they should. I'll check a third-party folder to see if the daughter has consented to this, and that's the first thing I'll do. Number two, I'll advise the relative to ask the daughter to call the surgery to authorize permission for the relative to know the results of the blood test. Confidentiality is a very strict law. It can't be bent. It's basically the law. It's the foundation of the GP practice. Number 4. The computer system has crashed. The waiting room is full. And you have a queue of 5 people at the desk. How do you maintain order? I'll do a step-by-step process. Since the computer system has crashed, I will change to the dimension of a pen and paper system. There might be a daytime book which informs you about the list of patients. It would be in a hard copy format. This will not always, it may not, I can't guarantee this applies to every surgery. The waiting room is full. So what I've seen and what I know receptionists do is they would leave the receptionist room to inform the 5 people via communication what has happened, so that the 5 people don't become frustrated. And communication is key in this scenario. Once the people know, it will reduce the amount of frustration, and because they understand now. And I'll try and use the day book to continue the system. It will be a different type. It will be more delayed. It will be slightly more complex. But as long as the 5 people know why it is more complex, why there are more delays, it would reduce the amount of frustration they may be experiencing. Number 5. Tell me about a time you made a mistake at work. How did you fix it? When I was volunteering at the age of between 16 and 18, I remember there was a obese patient, and I assumed they were pregnant. That was a very big mistake. I saw from their reaction, and I apologized promptly. I regretted that situation a lot. Another time was when I was using an older software called EMIS LV. I was briefly taught how to use it, but I was still making errors because I was only shown once what to do. And fundamentally, excluding the non-pregnant lady patient, I haven't really made mistakes in the GP receptionist voluntary role. My mistake when I was between 16 to 18 was very sloppy, but at that time I was very inexperienced with communication with the public, and I didn't know about these things very clearly. I do know that when there are mistakes in general, for example, I did read up about mistakes in GP receptionist. Sometimes they make a filing error. Sometimes they say something, they give incorrect information, like they mix up the information. Things like this could happen. They could say a patient is booked when they're not actually booked. In this scenario, you would go to the supervisor and you have to admit the mistake you have made. It's not a matter of shame. It's a matter of patient safety, because when you make this error, the first thing that you should be thinking about is the patient safe? Have you compromised their safety? But what I mean by this is mixing up the file going to be a detriment to the patient? Of course it will be. There's a significant chance it will be. This is how you're supposed to think. You're supposed to prioritize safety over speed. So inform the supervisor. It's unlikely he'll be frustrated at you, but even if he is, it's not going to bother you, because you've admitted the mistake. You're prioritizing patient safety, and ultimately that's the foundation of what a GP practice is based on. Thank you.